Alexander Khara, we've run out of time, but thank you very much for joining us. Despite being in a difficult situation, there are power cuts at the place where you are. Ukrainians are facing water shortages, food shortages, but despite that, the resolve of an ordinary Ukrainian has not been broken. Thank you very much, Alexander, for joining us. Shifting focus now to the measles outbreak that the World Health Organization is worried about. The outbreak has now spread to at least 26 nations, as well as large parts of India. The central government has rushed special teams for 3 states. The other major concern, record high COVID cases in China since the start of the pandemic. I caught up with Dr. Margaret Harris, WHO spokesperson, and I began by asking her about the outbreak of measles and the seriousness of it all.
Our progress towards eliminating measles is really now threatened by major setbacks that started in 2020 during the COVID-19 vaccine pandemic. We're now seeing record lows of under-immunized or not immunized children. Nearly 40 million children now are really susceptible to measles outbreaks. So we're in a situation where it's an imminent catastrophe, but one that we can turn around if we take action now.
And is this primarily because over the 2 years of the pandemic, the immunization for measles took a back seat?
Everything really, unfortunately, took a back seat. We've seen that routine immunization of children was severely affected because the world was focusing on COVID. Interestingly, we didn't see large outbreaks of measles when so much of the world was in lockdown. But now we are seeing outbreaks, and now we've got, as I said, huge numbers of very young children who are susceptible. And this is a deadly disease. This is a big killer of young children.
Which are the countries which could be the worst affected, and where you're seeing a big rise in measles cases?
We've seen at least 26 countries reporting outbreaks. Now, one of the biggest problems is surveillance. So while I'm talking about outbreaks, we know that there are many more cases that are actually being reported because, again, countries were so focused on COVID that the testing, the tracking of measles that was going on before hasn't been happening. And now it's critical that countries really step that up to protect our most precious asset, our small children.
Right. What about India? Any outlook on India? What is the situation with measles as far as India goes?
It's an issue for India as well, definitely. Of the 10 countries with the largest number of unimmunized children, India is one of them. Now, of course, India has a huge population, so that's why you have those large numbers. But India also is very good at immunization and very good at public health. So it means that India can turn this around and needs to focus, really be committed to getting that surveillance underway again, getting the immunization happening, really building up the local basic healthcare services and encouraging parents to bring their babies to be vaccinated at the right time.
Any immediate measures that you're recommending to countries, especially India?
To all countries. This applies to all countries. There is not one WHO region that is doing well at the moment. So this is something that we as the world really face. Measles is a highly contagious virus. In fact, before we saw COVID, the Delta and Omicron versions of COVID, it was the most infectious virus on the planet. And one infected person can infect another 20 people around, 18 to 20 people around them. So it spreads like wildfire. So every country, every health service in the world needs to really now step up efforts to track measles and to get all the children immunized.
Right. My final question, Dr. Harris, and this is on COVID. The news coming in from China that with over 30,000 cases, China is seeing a record high in daily cases since the start of the pandemic. How serious is this for the world right now?
Well, this is a warning. COVID certainly hasn't gone. Now, a lot of countries have really stepped up their vaccination, and that is protecting a lot of people. We're seeing fewer people die, but we still are seeing 7,000 to 8,000 people dying every week. And so COVID is not last year's news. It's still very much with us. And we have to take COVID as seriously as the other threats.